Today we're going to look at a paper published in Physical Therapy. That's a journal. And the paper's title is An Electromyographic Analysis of Two Techniques for Squat Lifting and Lowering. Now this, on the surface, looks pretty cool because it compares two techniques of squatting and it compares those two techniques at three different loads. Now, could these techniques be the high bar versus low bar back squat? Could it be front squat versus back squat? Or maybe some other permutation of squat technique? Well, let's go look at this. Now, the stated hypothesis of the paper was that the alignment of the pelvis, either anterior tilt towards you, or posterior tilt, the top of the pelvis tilted back towards me, would change EMG activity in the back and abdominal musculature. Now, this is curious. In what style of squatting do we tilt the pelvis backwards? If we front squat, the pelvis is more upright, and in the back squat, the pelvis is more anterior tilted towards the bottom of the movement. This, in both of these instances, is an anatomical and physical necessity. We just don't tilt the pelvis willy-nilly. It does so for a reason. But this is interesting. This tilt thing is interesting because lots of people have been talking about it, butt wink and things like that. So let's look at their take on this tilt issue. All right. So let's go look at the methods. Well, we don't even get there. This isn't in the methods. This is in the body of the text prior to the methods. Now look at these figures. These are their assessed exercises. These are the squats they're talking about. Now, these aren't squats. They're both mutant deadlifts done in really mechanically disadvantageous and unstable positions. I mean, just look at this. How far out in front of the area of base is the load? And how big is this area of base when you're basically up on the balls of your feet as a starting position for the lift? Well, there goes any relevance to the squat. And there goes any relevance that might be had to actually advising people that work in the gym or exercise in the gym about squatting. The loads they used in these exercises range from 2 pounds on up to, I think, 45 pounds. And there was no reference anywhere in this for technique, how technique changed with these different loads other than EMG activity. Because the loads they used, 2 to 45 pounds, you can easily, with 2 pounds, which is this empty milk crate, can hold it out in front of your body without any additional mass or any muscular contraction on the back or the abdominal musculature. Whereas if you put 45 pounds in it, it's going to definitively swing back towards the center of mass. It'll go underneath the torso until it comes in contact with the thigh. So where there's some problems here with how they design this particular exercise intervention. Now, it is also interesting when we get to their results and their discussion is how they interpreted EMG data. Most frequently, clinical researchers claim that there's an association of increased EMG activity with increased risk of injury. In this particular paper, however, it's claimed that the increased EMG activity noted is a safeguard. So it runs counter to conventional clinical wisdom. Now, another anomaly in their EMG results is their representative EMG tracing. And what generally is meant by anything representative in a scientific paper is that that's the best one that they have. That's the cleanest tracing or the cleanest result they have. They use those simply to demonstrate their findings, demonstrate their point most easily to their readers. But I want you to look at this EMG very closely. The magnitude of the abdominal activity is very, very low. In fact, if you look at the left oblique abdominal musculature, the external obliques, the only peak that you really see is sort of masked within the background noise of the EMG tracing. Now, look at the right and left spinal erectors. Well, here's the left, not much activity going on here, and here's the right, and there's a lot of activity going on. If EMG is directly correlated to contraction, this should have resulted in a deadlift, not a squat, with a trunk twist, because the right erector is actually firing and the left erector is minimally firing. So essentially you'd have the right would be shortening while the left didn't do anything. So we would see a torsion or a flexion of the vertebral column. Now, this wasn't seen, so somewhere in this experimental method, there's a theoretical or methodological problem. Now, they do note that in reference to the abdominal musculature, that they did have an explanation in that for this lack of activity or very low level activity is that they suggest that abdominal activity has very little to do with spinal or vertebral column stability during lifting. And there's a number of papers that don't support this concept. So we have a number of problems with this paper. Now, without going into the paper any deeper, because this was a paper not about the squat, as implied by the title, and by the text. We need to assess what from this paper we can apply to doing a squat in the gym or moving more weight. So what is it from this paper that we can apply? And how can we help people teach the squat better or perform the squat better? Nothing.